Hey there, empowered mamas. I am shooting you a quick video to talk about reasons why you may have pain with sex or pain around your C-section scar. So we're going to start with the perineum first. And if you had a vaginal birth, you more than likely at least had a little tear. We call them grade 1, 2, 3, or 4 tears. And you can see over on this picture that a grade 1 tear is just a real small, usually just a few stitches, mainly just skin. A grade 2 tear now goes through the superficial layer of pelvic floor muscles and often is the exact same as an episiotomy. So that would be counted as a grade 2 because they have to cut that first layer of muscle. Those are the tears that we are hoping that you are having, but a more extensive tear could be a 3rd or 4th degree tear. So a 3rd degree comes down into the external anal sphincter, and the 4th degree tear goes all the way through the external anal sphincter and the internal anal sphincter. So mamas who have had 3rd or 4th degree tears may have more things like some bowel urgency or some fecal leakage. And if not now, it is really imperative to start working on strengthening, because even if your tissue is resilient enough to recover well from an extensive tear immediately postpartum, as we get older, as we start to lose estrogen and get closer to menopause, then that tissue thins a little bit and may not be strong enough any longer to keep a mama from having those sorts of concerns after. So there are three main reasons why a mama might have pain immediately postpartum. One is if you have chosen to breastfeed, then your tissue has very low estrogen levels, very similar to a sweet 75, 80-year-old vulva. That's probably how yours is looking, because the tissue gets really thinned out just because of prolonged decrease of estrogen while you're nursing. It has to happen for us to be able to make milk. Estrogen has to be down, progesterone has to be elevated to be able to balance the other hormones necessary for us to produce milk. But because of that, our vulvar tissue can get really dry and it may need extra lubricant. In that case, I would say please don't buy anything with glycol in it, which typically is like the KY jellies or any of the ones that have like extra special warming such and such in there. Those things you want to avoid. You want to keep as clean of a product on your vulvar structures as you can. So there's Good Clean Love, there's slippery stuff. There's a few other really good options that are low in chemicals that are a little bit better for your tissue. One of the other options for dryness is using some topical estrogen. So this is something you want to talk to your physician about, but know that local estrogen that you just put directly on your vulvar tissues doesn't go systemic. It doesn't get synthesized through your liver. You're not looking at any other kind of systemic hormone concerns that may be in the back of your mind. So it might be really lovely to be able to use to kind of bulk up that tissue if you feel like it's raw and itchy and sandpapery and just irritating all the time. Okay, so that's dryness. The second problem could be that these scars aren't moving well. And so working on, let me grab my vulva puppet. So working on being able to use one finger, put your finger into the vaginal canal about to the depth of just your first knuckle. I'm going to use 2 fingers just because she's got a pretty sturdy vulva here. And giving just some gentle stretching. Put your fingers right on any tender point, which probably tells you that's where the tear was, and give some gentle cross friction, or just hold it and let it soften there. You could do a little bit of gliding. But basically, if you have a scar like that, you need to at least be touching it, moving around, and making sure it slides and glides well so everything can move well. So you could have a scar that's kind of bound down. Now, the last reason would be that if those muscles that just had to elongate 3.5 times their normal length to let a baby's head out, sometimes they get a little ticked at that, and then they tighten and hold, and so they become overactive. In that case, you can do the very similar massage, working on gently stretching those muscles with your fingers 2 to 3 minutes every day, and also working on kind of hip opener type stretches, child's pose, happy baby, those types of positions can be really lovely in helping you stretch out your pelvic floor and get it to elongate and lengthen really nicely. And then C-section scar wise, I just want you to think about if this scar down here is super sensitive to touch, like you can't stand to have clothing or bed sheets or anything on it. Scars can become really hypersensitive. Those little receptors that normally tell us the difference between light touch, deep pressure, and pinprick, once they get cut through, sometimes they get really all fired up and everything is pain. So even light touch, which should feel like light touch, your body is reading as painful. So if you take just something a little bit rough, like a old dry washcloth, and rub it over that tissue for a couple minutes every day, it'll take 6 to 10 days, and usually that resolves really nicely. But then you have to be moving that scar as well. So you can see how this mama has her hands down on her belly. If you went a little further down and were right over the scar, and just gently up and down, side to side, obliquely, but also thinking about, can you get the scar to lift up well? Because that, you want tissue to be able to move in or out, side to side. Our bladders have to fill up and empty. Our guts need to move food around the system for our digestion and good absorption. So we have to have a lot of internal movement, as well as the stress that goes externally when we're picking up baby, when we are picking up car seats, strollers out of the car, bags of grocery, bags of dog food, any of those types of things. So you really want to get your hands on that scar. I know it's hard. My third baby was breech, and I did not like working on my C-section scar either. Even though I'd had my hands on people's bellies for decades, it still was really challenging to be able to do that myself. So I hear you. And I am still telling you to get it done, to make sure that these scars move well and you don't have impact of how well your belly muscles kick in if the scar is not moving well. So if you want to learn more about this, keep your eyes open for our upcoming postpartum recovery course called Learning to Thrive Postpartum. If you go to our Linktree link, which I will put in the feed here, there is a wait list to be able to sign up for information about the course. So if you're interested, throw your name in there and you will get some announcements of when that is coming. It's a 4-month recovery program that we're launching 3 to 4 times a year. So you'll get announcements on when the next time it is that we launch. But we show more in-depth videos of things like this, how to do a C-section massage, how to use cups and things over the area to get it to move well as demonstrating perineal massage and all sorts of strengthening progressions. There's a lot in there. Check it out, and we'll see you soon. Take care.